Good evening, guys. It's Sunday, it's 9 o'clock, and we are live. And it's only me. Mum has decided to have a life. It's a shame, I know. And Dr. Q. And we are with wonderful Lisa. And Lisa is having a new procedure done. So I'll let Dr. Q explain what we are doing tonight.
Right, so what we're going to do is nose reshaping with fillers, or also known as non-surgical rhinoplasty. So with Lisa, she's got a small notch in the nose here in the middle. So it basically gives her like a little hook appearance. So there are two ways of doing it. Surgically, you would basically need to sort of break the nose, chisel it, and sort of reform the bone. Non-surgically, what we're doing is placing filler, which is the same kind of filler that you use in sort of cheeks or lips. A little bit above the notch here, and then a little bit below the hair, just to sort of straighten out the profile. So we've put some cream on to numb the
So just so everyone knows, this is like having a nose job, but without having a nose job.
So it's a non-surgical nose job. So what we do is we make a little puncture in the skin.
Now, Lisa will tell you, but not at this precise point, she is marginally nervous. But that is understandable. And I like the fact that you're nervous. And I know that sounds ridiculous. But if you're nervous, that shows you what everyone else feels. It is quite normal. You have lots of your lovely family coming to see you. So that's Courtney's watching. And I'm sure there'll be probably plenty of others. Hi, everyone. I know there's a lot of people watching, but I can't really see all your names at the moment. They're just pinging in front of me. And Tracy Carrington, who we did a couple of weeks ago. I can't remember what we did. I think we did, I don't know, she looked bloody fab at the end of it. I have no idea what Mum does. She just does what she does, doesn't she? Okay. So we are all good. And roughly how long does this procedure take?
Right, about 15 minutes or so. So the main thing is just to find an entry point, which is not bleeding. So
preferably.
Nose is quite vascular, so it bleeds quite easily. So because this one's still bleeding a bit, I probably won't go through this one. I'll just get another one.
And question, Dr. Q.
That's it. Okay, that's
You're
it.
good. Don't apologise, God's sake. So, quick question for you. Now, this lasts for how long?
Right, so...
Because obviously a nose job is forever, right?
Yeah. So this will last about a good part of a year. So obviously maybe also 9 to 12 months. It's reversible. So for example, if you don't like it, we can sort of dissolve it out and you get your old nose back.
There we go. So basically this is like the designer nose. Yeah, kind of, isn't it? They say that about the women's area. You can get one of them designer women's area. Sorry, I shouldn't say that because now you're going to like laugh. Don't laugh, don't laugh. But, you know, apparently that's like a thing now.
Yeah.
Is that a surgical procedure?
I don't know. I don't really do them, so...
Maybe I'm gonna have to do some research on this one just to find out, because now I'm intrigued. I'm quite sad like that. So Mum was at Aesthetic Medicine Live today, and the last I heard, she said that she spoke to people about new lasers, because of course she does. She is a bit of a laser junkie and does love lasers. And also she went and she found some new training courses that she's quite looking forward to doing, I think. So now, Lisa, I'm going to give you my bit of advice.
What?
Close your eyes, babe.
No, I just saw it.
It's not that big. It's quite a small one, really.
A needle that's basically is a cannula. A cannula is like a blunt needle, so that it doesn't injure any vessels.
Oh, there we go. Wow, that's the quietest I think I've ever been in my entire life. And do you know, it's very strange without Mum. I mean, Mum was quite quiet without me. She's not very good at chatting, my mum, which seems very strange because actually I am epic at chatting, as everyone that comes to see me will know. I could literally talk to a wall. In fact, sometimes when I'm at home, I do feel like I am talking to a wall. So I'm going to go from this angle and just so you can see. There we go. And it's
Right, so that's the sort of cannula. So it's in right at the top of the nose.
and so will this take out that wee sort of small bump that she
Yeah,
has?
so you can see this little bump here.
Yeah.
So what we do is basically just put a small amount of.
And so this is just filler, isn't it?
Mm.
So basically we're just filling the nose. That's amazing. Your beautiful sister has come to see you. Hi, Sam. Right, I'm going to go through some of the people that are watching us because there's loads. So we've got Courtney, we've got Tracy, we've got Karen, we've got Eileen, we've got Lisa, we've got Deirdre, we've got another Tracy, we've got Fiona, we've got... Oh, Charlotte, that's me. Oh, I don't think I'm that mean to Mum. Jessica, Rosalind, Lee, Jessica, another Jessica, Sam. Oh, Sam says you're so brave. Oh, bless. It's all right, Sam. Mum is going to come and she'll torture you. Oh, and we've got Pamela. There we go. Look, oh, it's looking fab, Lisa. It's looking fab. And so with this, is it a case of we put in and then we smooth?
Yeah, so basically placing the filler above and below where the notch is, and then we just sort of smooth it into place.
And so if you find that you maybe are not 100% with the shape, then is the shape kind of maneuverable?
Yeah, so I mean the filler takes about 40 minutes or so to set, so you can sort of mold it until then.
Oh, bless. Oh, well, Sam says she's sweating watching you. I think Lisa's doing fantastic, I have to be honest. It is very scary, these procedures, and I can actually speak on, I was going to say, I don't have much experience, but I actually can speak on experience. Dr. Q has done many things for me and my mother. He is fantastic and likes to take all the age wrinkles out of my mother, which apparently has made my mum into a MILF. I didn't actually know what that meant, but then wonderful Joe continued to tell me that it's actually a gilf when she's a granny. I was like, oh, for God's sake. So as you can see, it's got, oh my goodness. It's a bit like magic. Oh. And not just anyone can do this, can they, Dr. Q?
No, it's quite sort of tricky. The nose is quite sort of vascular, so there's lots of blood vessels which you need to avoid. That's why we use a blunt sort of cannula, not to sort of puncture anything.
Oh, well, you've got lots of people coming to watch you, Lisa. Mm-hmm. You're doing fantastic, babe. You really are.
Thank you.
I have to say, though, I do really, really like your gold. I mean, the gold is fantastic. But I'm dreadful at doing makeup. Your sister does my makeup for the reason that I am dreadful at doing makeup. I think waking up and washing my face, I've achieved a lot. Like, genuinely, that's me classing myself as, like, I've really put effort in for the day. Because I'm one of these people that are like baby wipes, and my mum goes so mad at it. She's like, you can't be doing that. You can. Of course you can. Wow. Oh, it's made such a big difference. My goodness. Oh, Lisa, I think you're going to love it, babe.
Oh, it's finished.
Almost.
Almost.
Yeah.
Okay.
You're doing amazing.
Does it feel a bit numb now?
Because
it has an anesthetic in it, so when I went in first time, I think it was a little bit slower, but second time round, I don't think you even realised,
No, it was...
It's a bit nippy.
I should imagine it probably appears a lot worse looking,
Yeah.
you know, watching it from that time.
And how did you feel that it was?
Do you know, the only part that was, and it wasn't painful as such, it was just a wee bit nippy, was when it first, when you made the
puncture.
Yes, the puncture. But that was the only time that it hurt. And then when the cannula went in, you know, there was maybe a slight sensation, but it wasn't agony, it wasn't painful, it was just...
But I think to sort of note when doing sort of nose reshaping is not to sort of lose this angle completely, because by putting filler here, you do lose the angle a little bit, but if you put too much, some people go, I want straighter, and then if you keep putting too much, and what happens is it becomes like a Klingon nose.
The thing is if it's too straight, it looks not natural. Because let's be honest, none of us are Greek goddesses where we have what's it? Is it Botticelli? Oh, that's probably such rubbish. It's probably not Botticelli. He's probably a musician or something like that. But, we're not moulded out of stone to being the perfect Greek goddess, and nobody is. Unfortunately, it's one of these things that we have to work on, and believe you me, I'm working on it too. Dr. Q, on the other hand, is the Greek goddess that he is. Would you agree with that one, Dr. Q?
Goddess.
Well, what's not a goddess?
Well, you never know. I think everyone's a goddess. Because I think it's the feminine part of us that makes us want to look amazing. Because Joe, bless him, actually doesn't really care. But then he is a plumber, so, you would be rather surprised if he turned up at your house in, some absolute killer ankle boots and, a bonny shirt. He is not like that. He's always covered in silicone and looking really rough, to be honest. However, here we like to try and make life slightly more beautiful. I love nails. That's my thing. Do you know what? So I think everyone knows that I have a child. So today, my child has got now teeth. She has teeth. And she decided to bite my finger, which normally, when they don't have teeth, is not a problem. However, she drew blood. She drew blood from my finger. She drew blood from my lips. I was like, oh my goodness me, this is ridiculous. So she's now officially called Shark Tooth. Because I think in my head, the only thing that could draw blood like that is a shark. Random fact for you all. Random Sunday escapade it was. I went to Brody, it was beautiful. They've always got such nice stuff in Brody, don't they?
So all we need to do now is just pinch this for a minute. I'll do it.
Oh, sorry.
Just for the sort of bleeding to stop, and that will be us. So you can see the nose is sort of pretty straight now.
It's pretty straight.
Yeah.
It's very straight. I'm going to go Dr. Q's angle. Now, guys, I was smart. I closed the curtains this time because, you know what, I look really rough today. But not as rough as I was when Mum had to do the video on her own because I genuinely lost 4 days of my life. It was horrific. Wow. Oh, it looks fantastic, Lisa.
Thank you.
I've never seen this one, guys. This is one of the only ones that I actually haven't seen. I have seen many procedures by our lovely Dr. Q, but this one is a new one on me as well. And it's amazing. See, my brother had his nose actually done. And I always kind of am a bit like, really? I don't think anyone's face is that bad to have surgery unless, it's something that you really, 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 really obsess about and it annoys you implicitly. I don't think anyone should do it. But then there's always a pro and a con, isn't there?
See, nose surgery is the one with the most dissatisfaction rate. A lot of people who have nose surgery aren't satisfied with it, even if the nose looks great afterwards. It's not what they had in mind.
It's hard, isn't it? It's a picture. You can't see what they're picturing, if that makes sense.
With this one, if you don't like it, you can dissolve it out. And it takes about 15 minutes, literally. So people, who had looking for changing their nose for, most of their life, it's just 15 minutes and it's done. Whereas if you go for surgery, then you have to put a lot of thought into it, because it's not easily reversible. And
from this point of view, is this a margin of the price of a nose job?
Yes, it's about, I would say, 10th of the price.
Oh, there we go. We're saving money, guys. I'm all up for saving money nowadays. I mean, I'm totally not. Mum will totally disagree to that because I just asked her for a perfume that's over 100 quid for the bottle. But I'll probably never get it. No, so Mum loves Tom Ford. But I found this really amazing one that I really like. And I'm quite into florally perfumes. It's called Tocca Florence. And the only place I can find it is Liberty of London. So, of course, I've been scouting. Mum has said to me, oh, don't worry, we'll get it on eBay. And I was like, you're not buying my perfume on eBay. Mum did that. She got for Brad for his Christmas the set of the Creed ones. And of course, they're so expensive, like so expensive. And Brad's like, Mum, are you sure they're real? And she's like, yeah, I bought them from a reputable buyer. How much did they cost you? £35. No, they're not real. Of course they're not real. They all smell the same. They smell like you know, what's that baby water that you put on? You know, the one that you put on the baby's head? Like, it's like
baby oil.
Yeah, like baby oil. It smells like baby oil. It's not good. And Mum's like, no, they're definitely real. I'm really dubious as to whether they were ever real. Bless. But of course, Brad is Brad. He'll be nice to her just because it's her. I would slag her for it. I like slagging her a little bit. It's quite fun. That's why I love that headband so much. Well, I really hate the headband. The headband is dreadful. But, it's prime for a slagging, that is. So, that's us pretty much almost done with Lisa.
Yep, so that's us really.
Yay! And how do you feel?
Yeah.
You've not seen it yet.
I mean, well, that's it.
No, it'll be great. I'm sure it'll be absolutely
I love that you say that. I might actually just stay on just so that you can see it.
Just pinch on it for 1 more minute and that should be it. Do we have a better?
Yeah, I'm sure we do. Give me 2 seconds. Normally I have things in this room. This is the room that I work from most of the time. But Mum tends to nick all my stuff. Oh no, guys, I'm sorry. I don't know.
On my phone, the front camera.
Yeah, that might be a good shout. I should have thought about that. Normally when Mum's here, Mum's like properly on it. Oh, I've set up and I've cleaned down and I've got everything ready. I, on the other hand, just turn up, talk and film. Which is, yeah, it's the easier of the two jobs, I would admit. But without me, there is no Mum.
So it takes like 30 minutes to set then, does it?
Yeah, before, and then you can't really sort of change it
Manipulate
after,
it, yeah.
afterwards, yeah.
So it will set into shape then.
Yeah, I mean, so it basically will feel like bone, so you shouldn't really feel, it won't be sort of, spongy.
That's like my ones in the side of my face,
Yeah,
which I want more.
because we did that, didn't we?
Yeah,
the cheeks.
I think we did. I was probably quite a lot in each. In fact, I know it was a lot in each.
You've lost more weight since then.
Yep.
Yeah.
Mum says to me I'm looking like a drawn out junkie, and I was like, oh, thanks. Cheers for that. I really, really appreciate all your compliments. But then she said that to me before I got married as well, and I was like, oh, great, thanks for that. It's all right. Me and Mum are really brutal to one another, and we're used to that. I mean, I think if she actually paid me a compliment, I would probably be in shock.
So,
I think I can. I think I can.
I may need to go and get you a real mirror, my darling. It might be easier.
I can, absolutely.
it's difficult because it doesn't really show. Maybe I'll take a picture of it. Right.
This is because we're so unprepared. Look, here we go. This is us Facebook living whilst taking pictures and everything. It does look fantastic though, Lisa. It really does, darling.
Thank you.
But then your face is fantastic anyway.
So that's it.
Thank you. Yes. So it's just you've lost the bump. Well,
Yeah.
I've lost the bump.
Yes, I mean that's it.
I went missing.
So, that was it before.
Oh, well, we go into Dr. Q's. There we go.
And that's it after. There's a bit of swelling you can see,
Yes. Yeah.
but as I said, you shouldn't really sort of get rid of all of this angle,
No.
because if you do that, then it becomes a very unnatural looking nose.
Yes,
Like
I can imagine it. Just
Klingon kind of nose, yeah.
Mhm.
Yeah, just
Very
come out of-
severe, I would imagine.
Yeah.
Well, I think that's us, isn't it, Dr. Q?
Yep. So I just need to sort of manipulate it a little bit more, and then that will be us.
How long does it take for the swelling to normally
To
go
go,
down?
maybe a day or two.
Oh.
Yeah.
There
I mean, it's
we
not going
go.
to be any more swollen than what it is,
No.
so it's not going to be black and blue or anything. Majority of the swelling is just because.
And did she get out of exercise with this one? That was the great thing about my last one when he said to me, "Oh, and don't do any vigorous exercise," and I thought, yes, and then I thought, I actually don't do that anyway. So it probably doesn't apply to me. However, it does apply to anyone that does vigorous exercise. Probably not the best idea. Anyway, ladies and gents, thank you so much for coming to see us. I have had so much fun chatting to you all, or chatting at you all, either way. And next week, I think we're back next week, and I believe Mum is here. But let me update you. Please stay tuned. Check my Facebook. We've got quite a few Facebooks actually. So yeah, check them all. But don't worry, if I put on one, I'll put on all, if that makes sense. Fantastic. We'll see you soon. Bye from Dr. Q.
Okay, bye-bye.
Bye, Lisa. Bye.